Hello all, today we will discuss about fever. Fever is an elevation of body temperature above the normal circadian variation as a result of the change in thermoregulatory center located in the hypothalamus. So fever is there when the axillary temperature is more than 37.2 degree Celsius or more than 98.96 degree Fahrenheit, or oral temperature more than 37.5 degree Celsius or more than 99.5 degree Fahrenheit, or rectal temperature more than 38 degree Celsius and or more than 100.4 degree Fahrenheit. The normal diurnal variation is 1 degree Fahrenheit. The normal body temperature is more towards the evening because of increased basal metabolic rate and increased skeletal muscle activity. Rectal temperature is zero point 0.6 degrees Celsius or 1 degree Fahrenheit higher than the oral temperature. Oral temperature is zero point 0.6 degrees Celsius or 1 degree Fahrenheit higher than the axillary temperature. In a menstruating woman, at the time of ovulation, the temperature rises by about zero point 0.6 degrees Celsius or 1 degree Fahrenheit and persists till menstruation occurs. This is due to the thermogenic property of progesterone. Chill is a sensation of cold that occurs in most fevers. Rigor is a profound chill with piloerection or goose flush associated with teeth chattering and severe shivering. Chills or rigors occur when the thermostat situated in the hypothalamus is suddenly reset to higher temperature due to presence of pyrogens. The body temperature then tends to rise to the newly reset level in the thermostat by conserving heat in the body by cutaneous vasoconstriction and involuntary contraction of skeletal muscles, experienced as chills or rigors, that occurs in bacterial, rickettsial, protozoal, influenzaal infections. With every 1 degree Fahrenheit rise of temperature above 100 degree Fahrenheit, the pulse rate increases by 10, respiratory rate increases by 4, basal metabolic rate increases by 7, oxygen consumption increases by 13%. Fever with relative bradycardia occurs in typhoid fever, meningitis, viral fever influenza, brucellosis, leptospirosis, drug-induced fever. Patterns of fever. First, continuous fever. The temperature remains elevated above normal without touching the baseline and the fluctuation does not exceed zero point 0.6 degrees Celsius or 1 degree Fahrenheit. And it occurs in lobar pneumonia, infective endocarditis, and Rick fever. Then remittent fever. Temperature fluctuation exceeds 0.6 degrees Celsius or 1 degree Fahrenheit, but it does not touch the baseline. Then intermittent fever, elevated temperature touches the elevated temperature touches the baseline in between. So touches the baseline in between. In hectic or septic type of intermittent fever, the diurnal variation is extremely large as occurs in septicemia. Then quotidian fever, it is a hectic fever occurring daily. Next, relapsing fever. Febrile episodes are separated by normal temperature or for more than 1 day. Occurs in Borrelia infection, rat bite fever. So, types of relapsing fever. Tertian fever. The fever occurs on the first and third day. Example, Plasmodium vivax, ovale, falciparum. Then quartan fever. Fever occurs on first and fourth day. Example, Plasmodium malaria. Then Epstein fever. It's a type of fever lasting for 3 to 10 days followed by an afebrile period of 3 to 10 days. Example, Hodgkin's lymphoma and other lymphomas. Then saddleback fever. Initially fever lasts for 2 to 3 days followed by a remission lasting for 2 days and the fever reappears and continues for 2 to 3 days. Example, dengue fever. Then in Borrelia infection and rat bite fever, both are associated with several days of fever followed by several days of afebrile period and then the cycle repeats. Then cyclic neutropenia, fever occurs every 21 days. Thank you.